Next, it's my distinct honor and pleasure to introduce Congressman Elijah Cummings. Just have a seat for a moment. As everyone I think here knows well, Congressman Cummings is Maryland's 7th District Congressman, has been since 1996, and serves most of Baltimore and Howard County. Congressman Cummings is a native son of Maryland. Went to Baltimore City College, Howard College, where he was Phi Beta Kappa, and then the University of Maryland Law School. But that wasn't always Congressman Cummings' trajectory. He did not grow up with people saying, "You're Phi Beta Kappa." In fact, early on in his life experiences, he had people saying, "You're not going to make it. You're a slow learner. You're not very gifted." And he also experienced others who finally saw a spark. He knows about economic capital and what difference that makes. He knows about social capital, and he knows personally about human capital investments and what they can accomplish for people individually and at a community level. Congressman Cummings is a passionate champion of social justice, of equality, and the elimination of those factors that result in the vast disparities among the citizens of our community. Reducing disparities and achieving equity is not an academic venture, as we have seen and heard today. It is a political process that we must engage in if we are going to be successful. Who better than Congressman Elijah Eugene Cummings to address us today? Thank you so much.
Good morning, everyone. We can do better than that. Good morning, everyone. I know it's just before lunchtime. I got it. I won't be long. But to Dr. Robert Blum, I want to thank you for your kind words. But more importantly, I thank you for your leadership. If we did not have this wonderful institute, we'd have to create it. It is so very, very important, and it has become a role model for other institutions throughout the country. It's not unusual for people in Congress to ask me about it because they're concerned about how their institutions like the Hopkins can connect with the surrounding community, and I want to thank you, Dr. Blum, for all that you do. But most important of all, I want to thank you for your passion. I've often said that if you really want to get something done, find somebody with some passion. Not only is passion effective, but passion is contagious. And so I thank you. And so today I want to thank you for, all of you, for being here, because there's so many other places you could have been. And you are here, I'm convinced, because you understand that we have a responsibility to confront and correct the health inequities in our community. And I know that many of you may not realize that those inequities do exist. But I'm here to tell you as a witness, one who lives in the inner city of Baltimore, lived in the same house for 32 years on Madison near North. I see it every day. And I tell people, Dr. Blum, that when we voted for the Affordable Care Act, I didn't get any sleep the night before. And then I got to the chamber 4 hours ahead of time. And I sat on the front row. And I had one prayer. I said, God, do not let me die before I vote for this bill. Because I knew how important it was. It literally was an issue of life and death, and it was a time where Americans who truly believe that health care should be a right and not a privilege for the few were able to stand up. No, was it a perfect bill? No. But I got to tell you, it has brought us a long, long way, but we still have a long way to go. And so it's the people like you, the ones in this room, and many of you, who made it happen. I've been asked to share some thoughts about reducing inequalities in the social and economic factors that affect our health as Americans. To me, a core part of the answer to this charge is sitting right here in this conference hall. You, my friends, already know how we can achieve a healthier, more productive, and more equitable society. You are the public health experts. I'm not. I've seldom witnessed so much expertise gathered together to confront what ultimately is a moral, practical challenge. My respect for your expertise is surpassed only by my deep appreciation that you are prepared to lead in what essentially is a political movement. And I was so glad to hear you talk about politics, Dr. Bloom. This is all about politics, all about politics. I see it every day. I sit on a committee where things like this are attacked on a daily basis. The Affordable Care Act and other kinds of measures that will lift people up. That leads me to a footnote. I don't know if you saw the film Sicko, but if you didn't see it, you ought to see it. As you all well know, it was by Michael Moore, about people who have insurance. But there's a part of Sicko that is embedded in the DNA of every cell of my brain, and it will become the foundation for my 25-minute speech today. When there was an English parliamentarian, and Michael Moore went to him and said, explain to me why they can have universal health care in Cuba, and why can they have it in France and in England. And this retired parliamentarian who wasn't running for anything, he said, it's very simple. He said, in the world he said two things. One, he said that so many people are trying so many people are afraid in the countries that have universal health care, the government is afraid of the people. He said, but in America, the people are afraid of government. Oh, he said something. But he said something else that I shall never forget, and I know it to be true. He said, in societies, you have the haves and the have-nots. And there's a constant effort to keep the haves on top and the have-nots on the bottom. I didn't say that. He said it. And he said these words. He says, as long as you can keep a person unhealthy, hopeless, no home, they will never rise up. Put that in the DNA of every cell of your brain. And when we're talking about rising up, we're not just talking about rising up and protesting or something like that. We're talking about them eventually becoming all that God meant for them to be. That's what this is all about. That's what it's about. So let's be candid and very clear. Efforts to mitigate the health inequities in our nation and city must necessarily confront the same cultural attitudes and political battles that have driven our national healthcare debate during the last 4 years. Who would have anticipated, for example, that efforts to assure all Americans access to affordable health care would be publicly compared to Stalin's Russia or Nazi Germany? Give me a break. I ask this question seriously. The reaction by some of the Patient Protection and Affordable Care Act went far beyond simple partisan politics. Some of the attacks, in my view, bordered upon hysteria. Many of the president's detractors, and my own, were people who themselves had fairly good health insurance, including people whose care is being paid for by Medicare. Duh. Our public option for the elderly and disabled. Many of these same opponents were the same people who now most vigorously decry our national debt. And this despite the fact that health care costs are a major fact in our federal deficits. I remind you of these apparent paradoxes to emphasize this fact. And listen to me, linking health, premature deaths, and socioeconomic factors, including race, poverty, and inadequate education, hits a very deep public nerve among many in our body politic. They don't like it. They can't stand it. So they create something called the sequester, where you take $1.6 billion from NIH. Hello? 1.6 billion. And that's only the beginning. Let me get my water break. I promise I'm not going to go over Dr. Blum. I know you're all on a tight schedule. And so, linkages challenge our deepest American myths about equity and universal opportunity in our society. And you will hear from Dr. James Comer in about an hour or so. But Dr. Comer, who I love and who admired for many years, is probably one of the foremost education specialists in the country. And one of the things that he says in one of his books, he says when people look at children and try to figure out why certain children aren't learning as fast a rate as others, there's a myth that all children have equal opportunity. Hello? And there are all kinds of myths. And so, ladies and gentlemen, my experience in the movement towards universal health care, as well as my life experience, has taught me a harsh truth. Our opposition in the struggle to reduce health inequities is more than an abstract policy debate. We're in a fight, my friends, a fight where lives are in the balance. Still, when I was asked to share a few thoughts about reducing health and survival inequalities here in Baltimore, I realized that this conference itself is part and parcel of the answer that you are seeking from me. We who are gathered here at Johns Hopkins understand an important reality that was the focus of the 2011 World Conference on the Social Determinants of Health in Rio de Janeiro. If we are to make the social determinants more equitable, we must begin by transforming ourselves. This is what the 2011 Rio Conference concluded. Our health sector must lead in reorienting itself towards universal access to affordable health care. This reality has helped me organize what I came here to share with you today. With your permission, I will share with you a few thoughts about what I've learned in my decades of addressing coming to terms with racial disparities, coming to terms with social class in our society, the politics of place, and learning how to sustain the politics of progress. Now, you got to understand that I come to this, as Dr. Blum said, you know, they put me in special education as a kid, said I would never be able to read or write. Some kind of way, I was very fortunate to run into a counselor who helped me. Not only, I ran into a teacher who helped me to see what others did not allow me to see, and helped me up, and eventually to help me to become a Phi Beta Kappa and a member of Congress and a lawyer. And one of the things that I did was I returned to my neighborhood because I didn't want to be like Charles Barkley. I wanted to be a role model. I wanted to be a role model because I felt so much had been given to me, and I felt like a piece of trash that had been thrown in the trash can, put in the dumpster, and on the way to the dumpster, I blew out of the dumpster, and I've been raising hell ever since. But I want you to understand that what you are hearing from me, a lot of what I am talking about comes from my pain. The pain that I experienced as a little boy living in poverty in South Baltimore. The pain of going to a 9-room schoolhouse and looking 150 yards away and seeing a 45-room schoolhouse, going to a schoolhouse that had no gymnasium, no auditorium. You know what I'm talking about, Dr. Simmons. No auditorium, no cafeteria, and barely a playground. But go 150 yards and see a white school that had everything I could imagine. And then the idea that we would go to the white school and for our plays, you know, like when you have a play, a pageant or whatever, and that was probably, although they thought they were doing us a favor, it affects your self-esteem. You try to figure out why is it that you don't have the playground? Why is it that you don't have the kindergarten room with a little wading pool for the duckies? Come on now. You try to figure out why you don't have nice hot cafeteria food. You try to figure out why your bathrooms are boarded up and theirs are nice and crystal clean. And ladies and gentlemen, when I think about if you want to deal with health care and you want to dealing with inequities, one of the things that we have to make sure that we do, and it has to be a part of every discussion, and I'm so glad that you're talking about it, ladies and gentlemen, we must educate every single one of our children. That is the greatest threat against our national security. Just this morning, I had a guy come up to me. This is the second time in the last 2 days. Guy comes up to me and says, Mr. Cummings, I need a job. I need a job. I said, well, what's the problem? I got a criminal record. So I started thinking about, and then he said something that I will never forget. 2 people said the same thing to me in the last 2 days. He said, if I do not get a job, I'm going to have to go out there and hurt somebody. What does that have to do with health care? It has to do with longevity of somebody possibly being harmed. It has to do with somebody, if you read the new Jim Crow, you got to read it, and how more and more African American, mainly boys and men, are being incarcerated on marijuana charges and no violence. Come on now. Politicians running around, I'm tough on crime. I'm tough on crime. And when you look at the numbers, it is appalling. Bobby Scott, one of my good friends from Virginia, has done phenomenal research, and I know some of you academics know about this. He says that you can lock up so many people that it becomes, out of a group, that it becomes counterproductive. No farther. Society, the group doesn't reproduce because the men are sitting in jails. And don't get me wrong, I don't want anybody to walk out here saying Cummings is soft on crime. I'm just saying we need to look at what we're doing. Ladies and gentlemen, think about it. in the African American community, the research I have seen, they don't have any monopoly on drug use. Hello? But they are the ones who get arrested. All you got to do is look at the stats. Let's leave that to the side and let's move on. But that is very significant. So anyway, the guy comes up to me and he says, I got to get a job. If you don't get me a job, I'm going to have to do something. And I looked at him and I said to myself, this is what I said to myself. He has a limited education. He has no health care. He's homeless. He has no job, and he has a criminal record. Where's he supposed to go? He can't do for his family. Where are they going to go? I am convinced that a lot of our, and if all you got to do is look at it, a lot of the health care problems that we experience in our country also have a lot of reasons, but one of the major factors is poverty. And so I don't know how you can have this discussion without addressing that. You addressing that, Dr. Blum? Are you writing this down or what? What are you doing? Huh? What you doing? Okay, I hope you're writing notes on about my speech. I said to you a moment ago, in the next 15 minutes as I finish, I said to you a few minutes ago that my passion comes from my pain. Passion comes from pain. Passion comes from pain, and from that passion comes your purpose. And from that purpose comes policy. My grandfather, who I never knew, was a preacher, as was my father. And grandfather was preaching, and he fell sick. This was long before I was born. He fell sick, and they took him home in a wagon. And when they got him home, they called the doctor. 2 doctors came to see grandfather. And as my father would tell it, my father was only 9 years old, and the 2 doctors came out and said, he's one of the young 2 white doctors, and the young doctor said to the older doctor, said, we got to get this man out of here, or he may die soon. And my father, a little boy, sitting on the steps in Manning, South Carolina, in what could best be described as a small hut, really, because you could see the floor you could see the ground right through the floor. The older doctor said he's only a nigger. And my grandfather died that night. It's so interesting, and this is interesting too, because my father, that thing haunted him all his life. As a matter of fact, the day before he died of a heart attack. After preaching, the day before he died, he was talking about his father and the way he died. Ladies and gentlemen, but out of that pain is why I have come here today. I pain for the grandfather I never knew, because he was dead before I was born. I have pain for the father who died before his time. As a matter of fact, my father had prostate cancer and went to one doctor. I'm not going to name the doctors. Went to one doctor, and apparently the doctor botched the operation, and I then had him come here to Hopkins. And I had an opportunity to talk to one of your greatest prostate cancer doctors at Hopkins. And he said, Elijah, whoever that doctor was, he doesn't deserve to be practicing medicine. I will never forget that. And my father, I ended up being a lawyer. I wanted to sue the doctor. But my father said, no. He said, no. He said, I don't want to do nothing to harm nobody who worked so hard to get to where they had to go. He just must have made a mistake, son. I don't want to hurt him. He got a family. This is my father talking. And he accepted the fact that for many years of his life, towards the end of his life, he found himself in phenomenal discomfort. And based upon what the Hopkins doctors told us, it was totally unnecessary. Ladies and gentlemen, we have to produce people to go out into the fields and actually have a commitment to people. I myself was reminded of this when I got treated at a certain hospital in Washington. And I told my wife, I said, baby, you know what? I have never been to a doctor who didn't touch me. And I was suffering from something that I should have been checked. But the doctor never touched me. And this is in the last 5 years. There's something awfully wrong with that picture. And one of the things that I have done, and the people keep asking, where do you find these health care providers? I just did a conference this morning with Medicaid Matters. And we were talking about how to get more people in the health care field. And one of the things I could have told them is that when I talk to particularly minority doctors and people in the health field, I always ask them one question. I ask every single one of them one question, Blum. One. I ask them, why did you go into the healthcare field? And 9 times out of 10 is either one of these two answers. 1 time out of 10, well, I have relatives. Maybe my father was a doctor and all that. Okay, that's the one. But 9 times out of 10, it's because they say they saw somebody suffer. They say they saw somebody in pain. They saw somebody mistreated. What am I saying? We've got a whole cadre of people in this city. We don't have to go to the Philippines to find nurses. We just need to educate the folk who are here, who have been in pain, whose pain has been turned into passion, and they want to carry out their purpose. Now, so that you don't get confused, don't get confused. I didn't say I had anything against immigration. I know how y'all do. What I said was every time I go to Coppin, when I go to Coppin, Coppin has one of the best pass rates of the Maryland exam in the state. And when I talk to those nurses, and I ask them, because I'm on one of their boards, and I talk to them, and they tell me, come inside. I did it because I saw my brother, he was dying of AIDS 20 years ago. I saw my mother, she had heart disease. My godmother, she died. What I'm saying is they have a pain, there's a pain, and there's a passion. But you know what? At Coppin and many of our other schools, what we are doing is we don't even have the capacity to educate them. We don't have enough nurses that are trained to teach. And then we don't have the room for them, but yet and still we'll go overseas to bring people over here. We need people working right here who has the compassion for their own community. That is very, very significant. You will not have people not touching you. I'm sorry, I actually went, I went off on that. I shouldn't have done that. Let me finish as I close now. Ladies and gentlemen, we had to be concerned about effectiveness and efficiency in everything we do. That's why I said you are the ones, you know what you're doing, you know what's going on. You're the ones who must lead this fight. I'll never forget when I went to the polls the last time, a senior citizen was standing there about to vote, and she was way back in the line. And so I said, Miss, may I escort you up? She said, no. She said, I'm going to stay in this line until hell freezes over. I said, well, why are you so determined? I can get you up in front of the line. She said, no, I want to wait. She said, because this is going to be the last time I will vote. I said, why is that? She says, because I have cancer. And they tell me this is the last time I'll vote. I said, well, how old are you? She says, I'm 94. And she said, but this is the last time, but it's a happy time. She said, I'm happy that I'm voting for this fella, Barack Obama. It just makes me feel so good. And I thought about that woman. I think about her often. Because basically what she was saying to me, and then she held my hand, and she said, I want you to do a good job. I just want you to do a good job. And basically what she was saying to me is don't drop the baton. She was saying, basically, I ran my race. I run long and hard, but don't drop the baton. And I would say to you that we are in a situation where we've got a group in Washington called the Tea Party. A small group. Well, a small group now. Yet and still, when 90% of the people say they want background checks, you got a small group of folk who are saying no. But we need to take some lessons from the Tea Party. If they can do that, then think about all the masses of us who are probably the silent majority. Some kind of way we have to speak up. If we don't do it, nobody else will. We must address the things that you are talking about today. We must do it. Don't look to your left. Don't look into your right. Pull out your mirror and look at yourself. We go around saying, oh, Jeff will do it. Mary will do it. And nobody does it. If you ever heard any of my commentary about the gun violence situation, one of the things that I said when we first started discussing this is I said I worry that we will have motion, commotion, and emotion and no results. And so I say to you, go out there and try to make our system more effective and efficient, and you know the things that need to be done. Finally, let me leave you with this last point. One of the things that I find very interesting, too, is that I was talking about young people, and we have a program, the Elijah Cummings Youth Program in Israel. It's a very interesting program. We send, Dr. Blum, 14 children to Israel every year. We pay all their expenses, the Jewish community and African-American community. But one of the things that I've noticed, which is very interesting, these are inner-city kids. Many of them have never been outside of Baltimore. We give them a passport. We pay all their expenses. They go off to Israel. They get a chance to see children from all over the world. We catch them in the 10th grade. We have a 99% graduation from college rate in 4-year rate, period. We have 99% of them going to college. We have millionaires. We have doctors. We've been doing it for 16 years. I wish I could repeat that program over and over and over again. But let me tell you what the key is, Blum. See, let me tell you what the key is. I figured it out. First of all, we expose them so that they can know how to dream. See, it's kind of hard to dream if you don't see anything to dream about. Number two, they get a chance to see other young people who have come from around the world who like the same rap songs that they like, do the same dances that they're doing, and they've got people talking about, people from various other countries, young people their age. Yeah, I'm going to be trying to make sure that I find a cure to pancreatic cancer. So here they are in this limited world in the 500 block of Kasuf Street, and then they go off and they see all these kids who are coming from around the world, who are up here, who are flying high. They say, I want to be like them. When they come back, they're much more serious students, and they all have been successful. The other day, don't clap yet, I got a story to tell you. The other day I was listening to CNN, and so I heard somebody come on and said, yes, and now we're going to have Victor Blackwell reporting from New York. So you know how you just, you're not really, you're listening, but you're not listening. And then I heard this familiar voice come on. I ran to the television, and I started talking to the television. I said, Victor, is that you? I said, Vic, you a little chubby dude, stuttering and stuff. Is that you, Vic? And come to find out, it was Victor Blackwell, a young boy from Emerson Village who could barely he stuttered. He was a little chubby fella, and here he was on television on CNN doing his thing. And what I'm saying to you, but Victor, I called Victor, and I asked Victor, I said, Victor, what happened to you? He said, when I took that trip, it made me have high expectations. Ladies and gentlemen, one of the things that we have to tackle is not only must we make the system, our healthcare system, fair and equitable, but we have to do something else, and that is for the people who will be the patients, for the people who will access that system, those systems, we must help them understand what high expectations are all about. So often people believe that they're supposed to die early. The other day I was in a high school that I lead, by the way. I'm the president of a school, high school, 450 kids. Had 150 of them in the auditorium. I said, how many of you all have know of somebody who was close to you or a relative in the last year who have died of gun violence? 2/3 of them raised their hands. And then I look at some of my seniors and they say things like, well, Cummings, I don't need to get that test because if the Lord meant for me to live, he let me live. And I don't expect to live but so long, so if it's my time to die, I guess I'll die. We have to teach people that we have doctors at Hopkins and Maryland who have been trained to deal with their ailments. Just like a doctor said in a seminar that I was in the other day, he said, Cummings, teach your constituents to be in the best of health. He said, because there was a time if somebody had cancer and they got to 75 years old, we would not treat them. He said, but now if they're in good shape, we'll treat them till they're 100. Ladies and gentlemen, we have to make sure that people understand that they must control what they can control. And then we have to make sure that the system is in place, that there's a healthcare system that's effective and efficient. And we have to make sure that whatever we do, that we be a witness, that we stand up for what we believe in. We do not have the right to be silent. This is our watch. That's why you're here. And so as you go off to lunch, don't just say to yourself, well, I came to Hopkins and I had a nice time. That's not enough. That is not enough. If you're not going to go out there and be a soldier in this army, go play golf, even if you don't play golf. And so to all the golfers, I didn't mean no harm. And so I say to you that we are on a mission. When I think about my life and I think about all that I've seen, all that I've heard and all that I've felt, so often I have to pinch myself. I have to pinch myself when I think about the folks that I've seen who have passed away, the folks who had great opportunities but could not see what they had in themselves. And ladies and gentlemen, we've got a job to do. And I just want you to know I'm on your side. Anything I can do to uplift your efforts and make them more effective and efficient, I will. And again, I want to thank the Institute for what you're doing, and may God bless. Well,